Please describe your worst experience after transplant. What kind of complications have you had? Have you required rehospitalizations?
I get sick real easy. Seems like I get a cold or the flu. That's kind of hard to adjust to like that. And then I was on the blood thinners for a while, and I get bumps and bruises all over my arms. Hard time adjusting to that. And just, I guess, working or being at a different pace. I do have to do things a little bit slower now than I did in the past. But it's difficult for me to say anything negative towards that because I have a new life, which I think is great. Last Christmas in December, that I had to come into emergency here, that I had a blood clot in my lung, and I was in the hospital 3 or 4 days for that. Then 1 or 2 months after that, I was back in here again with the flu. Then again, 2 or 3 weeks after that, I was back in here again like that with pneumonia. And then this past weekend, I was here Saturday night. It was a false alarm like that. They still diagnosing what the problem was. But, outside of that, everything's been status quo.
Well, the worst experience I had when I finally did wake up, they told me I had new lungs, and I told them they were lying to me because I couldn't breathe. I had tubes in my throat and everything else, so I didn't feel like I had new lungs, and they told me for 3 days I had new lungs, and I still wouldn't believe them. And so I finally come around to the fact that they did give me new lungs, but there was other things going on. And so I developed blood clots while I was in the hospital, and I came back and I got scanned, and they said the blood clots were gone from where they were. And then I went home. One night we quit doing the Lovenox shots, the blood thinners, and Christmas Day night, I had a blood clot come loose and go into my brain and blow up and give me the worst headache that I ever had in my life, and it was just torture. So I'm still on the Lovenox now, so it's that was the worst experience. And some of the other things with the C-dep that happened, it's not a pleasant experience.
But one of the things that you have to be aware of is that transplant patients are extremely susceptible to skin cancer, and that has been the biggest challenge that I have. I've had about 8 or 9 surgeries on the top of my head, my scalp, because I am a bit follically challenged anyway. But it has been the biggest challenge that we've had to face dealing with skin cancer. And it's something that we've been working very closely with the San Francisco UCSF dermatology department. We're experimenting, I shouldn't say experimenting, but we're trying different drugs and creams to reduce it, and we are having success with that. So staying close to the dermatology department for a lung transplant patient is extremely important.
The worst experience was the first weekend at home, and we did not know how to properly work the feeding tube. I went home with a feeding tube, and something went wrong, so we had to call the emergency number, and it was panic. It was just a bit of a panic on all of our parts. I'm the patient looking at them, and they're looking at me like, what do we do? And it's like, call the number. They said call anytime. So it worked well, yeah. I have not required rehospitalization, but I did contract a fungus infection, Aspergillus, that is being treated now.
My worst experience after transplant was when I got the swine flu. And it was something that I was very scared of, and I knew it was going around, and I was trying to avoid it, but somehow I happened to get it. And I ended up with pneumonia. I was admitted to the hospital, and it took about 5 days to treat it, and then some ongoing treatment at home. And it was just really scary because that was the first time I got really, really sick after transplant. I think it was maybe 5 years after the surgery. And I came out okay on the other side, but all in all, it just was not a fun experience. The main complications that I've had are fungal infections. I've had very little rejection. I've had a couple acute episodes that were easy to treat, but I have had ongoing fungal infections. And throughout my first year, I was actually on IV treatments at home for about 9 months, in addition to breathing treatments and oral medications, because we just couldn't seem to get rid of this fungus. And I try to take a lot of precautions now when I'm gardening, or my family has horses, so when I'm out on the ranch, I'll wear a mask just to try to avoid that fungus, because that seems like something that my lungs like to grow. I have been rehospitalized 2 or 3 times since my transplant, so actually not bad for 11 years.
I'd say I have 2 experiences that run neck and neck, so I'll tell you both. I was in the ICU, and this was probably 3 days or so post-transplant, well, after I woke up. So I was unconscious for 5 days. Then I woke up, and then I couldn't sleep for 3 days. So I was delirious and hallucinating and all of that, but that was actually kind of fun at times. I think I fought Batman one night. I was so out of it. But when I finally did doze off one night, I woke up and I was vomiting some very, very acidic something. I don't know, it burned my throat. And I was already having a problem talking. I couldn't talk at all, and it was scary. I mean, it was so acidic, it hurt a lot. And it scared me. It honestly scared me. I couldn't talk that night, couldn't talk the next morning. And so when I dozed off again, which was, I guess, somewhere in the middle of the night, I woke up and there was all these people in the room and they were doing a bronchoscopy on me. And what alarmed me about the situation, I was already experiencing anxiety at that point because I'd been through so much. But what alarmed me about the situation was that many people, and I'd say it was maybe 10 or 12 people in the room, had time to get in the room, turn on all the lights, wheel in the bronchoscopy instrument, and they were already in my lungs looking for something because they couldn't wake me up. So, it was an alarming situation for them. They tried desperately to wake me up. They couldn't do it, and they were looking in my lungs to see if I'd aspirated something or something like that. The other situation that I had was maybe a month post-transplant, and I had what they call acute pulmonary edema, which caused me to start coughing up blood again. I guess my blood pressure spiked, and I ended up passed out on my porch. I had just enough wherewithal to call 911 and tell the ambulance or the paramedics to come and where I was, and that I was a transplant patient and that I needed to be taken to UCSF before I passed out. Thankfully, they got there quickly because I was without oxygen for I don't know how long, but I woke up the next day in the ICU. So I think those two incidences were the most alarming.
My worst experience after transplant does not really involve my lungs. I just feel like my body is more susceptible to things as a result of transplant. So I've had a really rare stomach ailment. It's called pneumatosis intestinalis. And it's a kind of a yucky thing. You get air in between your colon and your abdomen, your stomach, and bacteria forms in there and it causes extreme pain in your stomach. And although it's not common for transplant patients, it's just something that happens as a result of being susceptible to such things. And so I would say that's my worst experience. My lungs have served me very well.
Actually, I don't think I had a worst experience. There was only one, I could call it minimal because it could happen, where my incision it wasn't healing properly. So I would have to go in and have it packed over a course of 2 months or more. And at one point I was a little concerned that it might get into the chest wall or whatever. But that was about the worst thing.
One of my worst experiences pre-transplant was when you have to go through all of the procedures beforehand. And the second time that I went through all the procedures during the right heart cath, where they measure the pressure in the heart, they ended up hitting my lungs. So I had a pneumothorax, and instantly I could tell that something was wrong, but the gentleman who was doing the procedure didn't think that anything was wrong, even though I was really trying to let him know that you need to stop this or take it out. So it took a little bit, and then I couldn't breathe anymore, and I was, getting really scared, and started to get up off the table, because my first instinct was get out of here. Even though what would I've done, I don't know, I couldn't breathe. And so finally there were other people in the room were like, something is wrong, so they brought me into some kind of intensive care thing, and they just had to put I can't really remember it, but they put something into my lung to release the pressure that was in there. And so instantly I was like, I could kind of breathe again. And so I was in the hospital for about 9 days after that, pre-transplant. So that was a little bit of a scary situation, but you sign the waiver, and it's one of the things that can happen. So just, don't read what it says are some of the things that could happen. They go over it with you too, but it is a possibility. So needless to say, they didn't make me get another one, so that was cool. And then post-transplant, the biggest, I only had to be rehospitalized once, and it was for, what do you call that? A diverticulum. I had something kind of grow in my throat. And every time I swallowed, I could feel this lump in there. And I was telling one of the doctors about it. And he was like, oh, I'm sure it's fine. And I'm a pretty good reader of what's going on with my body. And so I was like, you know what? I live far away, about 4.5 hours. And I'm not going to leave until a CAT scan's done or something. And so they did one, because I was being kind of a brat about it. So if you ever feel like something isn't right, you gotta sometimes you have to push it. So they did a CAT scan, and they're like, stay in the city, we'll look at it. And then I got a call about an hour later, and they said, we're gonna have to hospitalize you, because there's something just that was growing in there. You couldn't see it, but I could feel it when I swallowed. And so it was just kind of like a pocket of pus, I guess, and they had to drain it. They'd never seen anything like that before. So now I have a ear, nose, and throat guy that I love here. And that was the only time I had to be rehospitalized. And if it would have broke, it could have went into my lungs and did some serious damage. So luckily they caught it in time, and I kind of pressed the issue. So that was good. And I was just on some IV antibiotics for a little while and had to hang out in the hospital. But ever since then, everything's been good.
Since transplant, I really have had very, very few complications. I've had no rehospitalizations. I did have a tiny issue with pain that was a little difficult to manage, but after a very quick stint in the ER for a couple of hours, I went home, and since then I have had no real challenges.
I think the single worst experience I had was in ICU. I don't know, 2 days, 3 days into ICU, I was bone tired, uncomfortable, couldn't get to sleep. I was hot, then I was cold, I was hot, then I was cold. The bed wasn't comfortable, and I was miserable. I wasn't in pain necessarily, but nothing felt good. Nothing felt right. And I thought to myself, dear God, what have I done? And then I kind of went, well, it can't be undone, so, you need to get through it. And so I had a fairly long conversation with God, kind of, okay, what are we going to do here? What do you want me to do? And we're good with that. So got over that. I think the second worst experiences were my stomach issues. So the vagus nerve got cut. And I have stomach, what do they call it? Gastroparesis. And so my stomach has, it's difficult to move food out of my stomach, which they realized once I threw up on the floor. And everything that came after that while in the hospital was just awful. There was an infusion of cola to see if that would dissolve the Bezoar that had formed in my stomach from food sitting there. That didn't work. I think if they'd worked, I think if they had used real Coca-Cola, it might have worked, but it was, Shasta Cola. Anyway, I then had a feeding tube inserted, changed, reinserted, changed, reinserted. All of that was awful. And then having to live with the feeding tube for several days, if not a week, was awful. Before the feeding tube got inserted, while they were still figuring out what was wrong with my stomach, I was on Dr. Kukrasia's, 7-day nothing by mouth diet. So that was kind of awful. So the stomach issues are still remain, just something that I need to be concerned about or adjusted to. I don't need to be concerned about it, but I need to adjust to them. So my diet has changed a lot. There no fibers food, or very little. All of that can be gotten through, though. I'm glad to be eating. I have had no rehospitalizations since discharge. There was one time I needed apheresis treatments that typically would have been in the hospital, but there was a flu epidemic here in San Francisco, so they wanted me to stay away as much as possible from the hospital. So we arranged them as outpatient treatments. So I came in for 4 hours, 5 hours, whatever it was, for several days, but I was not rehospitalized, and those went fine. I'm still doing monthly IVIG treatments, which is an infusion of immunoglobulins that keeps my system compatible with the donor's organs. But all of these are gotten throughable. The feeding tube is kind of what it sounds like. They insert a tube, which is, I don't know, probably a meter long, maybe, up through your nose, down through the back of your throat, and into your stomach. And it has to go through your esophagus and the first part of your stomach, and then be situated properly so that it's so that your system is ready to receive whatever comes through the feeding tube. Once it's inserted, they are feeding you liquids. I want to say mush, but it's not mush. It's liquid, kind of thick liquid, to nourish you. And they're also crushing your pills, whatever drugs you need that's not coming through the IV. They're putting it through the outside of the tube. So the tube will go through your nose and then be taped to your nose so it won't slip around and slide. And then attached to that part of the tube is a funnel, for lack of a better word. I mean, it's a funnel, and that gets lifted up, and the liquid food and medications get dropped through it. It goes through the tube and into your stomach, and that's the way you are nourished for the time period that you're on the feeding tube. It's icky. It's icky.
The worst experience I had after transplant was maybe 4 or 5 days after the surgery. I was beginning to have a real reaction to some of the medication I was taking, and I couldn't sleep hardly at all for, a couple of nights I couldn't sleep at all. I just really nervous. I felt like my skin was moving. I just had a really weird reaction, and I didn't understand it. That's what scared me about it. I didn't understand. I thought maybe something was going wrong with my transplant. And then when I found out, we realized what the problem was, and adjusted medications and taken things to counteract that, then it was nice. But I was a pretty bad person for a couple of days to be around, and only because I just, I didn't understand it. But that was probably the only real problem I had after the transplant. I've really not had any real complications. I had one minor rejection that occurred about 6 or 7 months after surgery, but I had no knowledge of it. It was so minor. The only way we could tell is because I had done a bronchoscopy and blood work, and that indicated that there was a possible rejection. So we did infusions for about 3 days locally, and pretty well taken care of it. That's the only real problem I've had with this. And of course, I've not had any rehospitalization since then, so it's been very good.
My worst experience after transplant was in the first couple of weeks. My heart rate got quite elevated. We think, complication of the surgery. The heart was irritated enough that my heart rate was going up into the 180s and 200s. And it was a very unusual feeling, and I didn't always know it was occurring. So getting used to identifying that was one very hard thing to do. And then I did have to stay for a short stay to adjust the medications further, but that's been my only experience in the hospital so far since. But it was very scary.